Hello, I am Dr. Heather Stone, the Director of Behavioral Health Services for Central Virginia Health Services, CVHS. CVHS provides integrated medical, dental, behavioral health, and pharmacy services across 17 rural and urban communities in Central Virginia. As you may know, the COVID-19 health emergency has changed how facilities across the country deliver health care. In saying that, CVHS is now providing tele-behavioral health services. You may have some questions about tele-behavioral health. Tele-behavioral health is mental and behavioral health services delivered by way of technology, using devices such as a computer, a tablet, or a cell phone that has audio and video capability. Although the licensed behavioral health clinician and the patient are not in the same location, the service has much of the same feel as an in-office session. To have a visit, you will need a computer or another device, such as a tablet or cell phone, that has a camera and access to the internet through Wi-Fi or an Ethernet connection. The larger screen of a tablet or a computer may provide a more comfortable experience. We are aware that some areas have insufficient broadband and cell service to allow for video communication. In these instances, we will offer phone sessions. You will also have to be registered as a patient with CVHS. We will soon be offering online registration, but until that is in place, registration can be started over the phone. CVHS behavioral health clinicians practice integrated care with medical and dental providers. So we are skilled at working with patients who must adjust and adapt to the changes that accompany acute and chronic health conditions. We also treat various mental health conditions such as depression, bipolar disorder, generalized anxiety, post-traumatic stress disorder, substance use disorders, and concerns related to the LGBTQ community, and much more. Our clinicians are equipped to deliver services to people of all ages. We offer individual, family, and group therapy sessions. Most insurance carriers are paying for telebehavioral health visits. Many have broadened the scope of accepted services. We can check your insurance to confirm it will be paid for in advance. CVHS also offers a sliding scale for patients who do not have insurance or behavioral health coverage. Please know that during this time, you will not be charged a copay in advance of the visit. Any copay will be billed after the visit. In preparation for your tele-behavioral health visit, you will want to prepare your space, your electronics, and your attention. First, you will want to find a private space where you can speak freely to your clinician. No one else should be present. You may want to have tissues, something to fidget with, and some drinking water. Do not worry about the appearance of your home. Your therapist will be focusing on you, not your surroundings. Electronically, you want to have your device prepared. To decrease the potential for connection issues, you can close out of other applications on your device. If you have Wi-Fi, you may want to be closer to your router. If you know where the best connection location in your home is for your cell services, you may want to go there. You can also have headphones ready if you have them. To prepare your attention for your visit, you should not use substances. You should be fully dressed as if you were coming to our office. You want to minimize distractions. avoid multitasking in your home while in therapy. If you choose to be in your car, consider where you are parked. You cannot be driving. You should expect that your clinician will always confirm your location before starting a visit. This is for your safety. When you join the session, you will be in a virtual waiting room. Then your clinician will let you into the session. If the behavioral health clinician sees an unexpected person in the background of your session, the session will be abruptly ended. While telebehavioral health is convenient for everyone, we cannot promise that our connection will remain stable. There is a possibility that the connection could be interrupted. If we are disconnected during a session, the behavioral health provider will make every effort to reconnect. Try to do the same. We cannot guarantee complete privacy. First, we do not have control over the environment where you are located. To increase the likelihood of privacy, we recommend identifying a private location for the visit and the use of headphones. Second, we offer use of a HIPAA-compliant telehealth platform, but some patients have had difficulty connecting in this way. During this health emergency, many telehealth regulations have been relaxed. So when our first platform does not work, we are using other video communication options, such as Google Duo. We cannot guarantee the data security when these other communication options are used. Third, there are also the typical limits to confidentiality as when we have an in-office session. We cannot maintain confidentiality if someone's safety is at stake. If a patient genuinely seems to pose a risk to themselves or someone else, we must act to preserve safety. We are also mandated reporters, so we must report any child or elder abuse and or neglect that we become aware of. We do keep records in our electronic medical record. This record is shared with medical and dental. Your medical provider could access your behavioral health records, and your behavioral health provider can access your medical records. We share information to provide patients with the best possible care. Last, our records could also be subpoenaed by courts. Thank you for taking the time to view this video. We know that people in Central Virginia are under great duress during this health emergency. The behavioral health providers at CVHS want to serve you. Please reach out to your local CVHS office to register or schedule an appointment. If you are new to CVHS and unsure which site is the closest to you, you can call our behavioral health care coordinator, Tori Pierce, at 804-481-9697. Thank you again, and take great care.